Hi, are you Carla?
Yes, I am.
Jim Venstermaker. Hi.
Hi, Jim. Very nice to meet you.
Nice to meet you. I'm going to be turning 65 in a couple of months, and I understand I have to sign up for Medicare, but I am like totally confused by the Medicare, Medi-Cal, Parts A, B, C through Z. I don't understand it. Can you help me?
Absolutely, 100%. So are you turning 65? What's your birth date?
My birthday is June 6, 1950, so a couple months from now I turn 65.
Okay, and now are you planning to sign up for Social Security?
Well, I haven't yet. How do I do that?
That you will actually do on the Social Security website, and we'll talk about that in a minute, but let's go ahead and start also with, because if you were already on your Social Security, what we would do is you would automatically be signed up for A and B. They would already do that to you. They'd send you your card. But
So part of signing up for Social Security signs me up for Medicare's A and B.
Yes, but if you have not signed up for your Social Security yet, you're going to have to manually do it on your own. So that's what it comes down to. So if you were already on Social Security, they would actually automatically sign you up. And since you are not going to be collecting your Social Security, we'll have to do that manually. So, there's 3 ways to do that. You can do that in person by going down to the Social Security office. Okay. You can do that via their website, or you can call them. Now, it does take a little bit to get through, or even sitting in the office, so it will take you a little bit to find out about that. But once you find out about that, we can actually take care of the rest of this and sign you up for whatever plan options there are. But let's go ahead and find out what direction we might want to go in once we get to that space.
Okay, let me interrupt you for a second because the letters have me totally baffled. So, Medicare A is what?
Medicare A is hospitalization. And what they pay for is, if you are hospitalized, they'll pay for everything except for $1,260. So you basically have a deductible, $1,260. And with A, again, that's hospitalization. So it's hospitalization only, and then I'll just go ahead and explain B to you while we're on track with that. B is any outpatient services. So MRIs, CT scans, visits with doctors, specialists, that kind of thing. And there are definitely out-of-pocket costs there too. So the goal is to put you on a plan that's going to absorb all of those other costs, so it actually is cost-effective for you.
Okay, good.
Okay, so getting you signed up for B, one thing we want to have to, or we're going to want to be aware of is how much your Part B premium is. There is a premium, and pretty much everybody pays for that. That premium is $104.90 per month at this stage. And except for if you're limited income status, you can actually get that taken care of, where you will not have to pay for it. Or if you make over $75,000 a year, then your premium will actually be increased. So we'll have to find out, do you make over $75,000 a year?
Well, yes, I do.
Okay, so we want to be cautious about that too, because you may be able to stay on your group plan, and we may want to do that. Are you? I guess the next question would actually be, are you going to be retiring as well?
Oh, yes.
You are. Okay, so then we are definitely going to have to put you on a plan. So, so whatever that premium is going to be, we'll find out from the Social Security office what the increase will be. So if you're making over $75,000, you pretty much guarantee you're going to have an increase.
Okay, well, help me understand this, because I have good health coverage with my employer now, but I plan to retire exactly at age 65, okay? And when I retire, I won't have that great coverage with my employer anymore. So I need for the Medicare to start right at that point.
Correct.
Going forward. And that'll happen automatically?
When you sign up, you're going to let them know exactly when it's happening. You can do it 3 months before, and since we're already within that time frame now, when you sign up online or in person or by the phone, you'll be able to tell them, I need this to start on June 1st. Because if you're retiring as of June 1st, we want, obviously, no lapse in coverage.
Yeah.
So, any other questions?
Well, how will I know that I have coverage? And that's my first question. My second question is, you said there was a premium of $104 and change. How do I pay that premium, and who do I pay it to?
That will actually come directly out of your Social Security, and actually, I guess that takes us back to our initial question of when you're actually going to start collecting your Social Security check.
I'll be starting that effective on June 1st of this year.
Perfect. So they'll actually withdraw that directly from your Social Security check.
They'll do it automatically.
Yes, and if you were not going to be collecting your Social Security, then they would actually just bill you. They send you a bill and you can pay for it that way. So, but generally it's much easier just to have them withdraw it from your Social Security check.
Good.
Okay, so moving into your options, once we've got this established, your A and your B established.
Well, what doesn't, let me think. I've got my hospital covered, I've got my doctors covered. Doesn't that take care of everything? I have a little deductible, but that's it?
It depends on what plan we actually put you on that's going to take care of and absorb all of those other additional costs we were just talking about. The deductible, like we said, for the A, for the hospitalizations. And let me just explain to you too, with Part B, you have the premium. You also have a deductible of $147. So basically, before you use Part B, any of the specialists or the doctors or any of those other services, you have to pay that $147.
I see.
Once that's paid for, you get the entire year of...
The rest of the year is covered by Medicare.
Yes. Except for now we have to go into co-insurance. And Medicare pays 80%, and you are ultimately responsible for 20%.
So my deductible is 20% of everything I use, seeing doctors and specialists and getting x-rays and all of that.
Yes, and just know...
And that's separate and apart from the $1,400 or so that I'm responsible for hospital Part A.
If you're hospitalized, yes,
Okay.
they're all separate. So
All
Part
right.
A has a deductible.
Right.
It also has a daily rate after 90 days, but we don't necessarily have to get into that. If you're hospitalized for more than 90 days, you're going to have a daily rate, and it's quite expensive. So that's why we want to put you on a plan that's going to pay for that. And then B, we have Part B premium, which you're going to be responsible for no matter what plan we put you on. And then we have the deductible of $147.
Right.
And then the 20% of any cost, and what they call that is actually co-insurance. So it's 20% of any type of care that you get. And again, that is just when you get A and B. We have plenty of options that are going to pay for all of that, so that we can make sure that your costs, again, are very effective.
So it sounds like I've got insurance for the hospital, insurance for the doctors up to a point.
Correct.
And what you're saying is that the smart thing to do is to have insurance for the rest of it.
Yes, absolutely. You can stay on A and B only, but I don't suggest that because, again, there's $0 premium plans out there. There's some that are anywhere from $175 to $200, and we can go a little bit into that right now if you want to kind of get an idea of what your options are.
So it sounds like I have a lot of choices,
Yes.
but what kind of choices are they? Are they just hundreds of different health plans, or?
Pretty much, and that's where I come in, is I can help start to narrow that down for you and find out what's best for your circumstances. Because really that's the goal, is we want to make sure that you have the richest benefits at the lowest cost to you.
Right.
And we want to make sure that you're getting the best care that you possibly can get. That your physicians are on the networks. If we're going to put you on a plan that you're limited to networks, but there are plans where you're not limited.
Well, you bring up a good point.
Got it. Go.
Oh.
It's fine, I can edit it out.
So it sounds like I've got a lot of choices to make.
Correct.
So help me with all these choices, because now I'm actually more confused about this than I was before.
Okay, so we'll kind of hone that in right now and get to where it's much more clarified for you. So you have your A and B. The first option would be to get what's called a supplement, and then again, like I said, that absorbs all of those additional costs.
Okay.
There are different options as far as the supplement is concerned, but we're going to focus just on one to make it simplified.
Okay.
But there are ones that don't pay for everything; they pay for some things. But we're going to talk about what's called an F supplement. The F supplement pays for everything, and of course, except for the Part B premiums. So you're going to have $0. All you do is you bring your Medicare A and B card with you.
Right.
That's a red, white, blue card. Once you sign up for Social Security, you'll receive that in the mail. It usually comes within a month's time. But once you get that card, you'll show your supplement card as well. And once you've done that, everything's paid for. So no
do I buy the supplement from Medicare, from the government, or is that somebody else?
You would actually buy that from a broker, like me.
It's it's just another insurance company.
Correct, yes. So there's multiple different insurance companies that we can buy from. What we do is we try and make sure that we get you the least expensive F plan. That is the goal there. So the advantages of a supplement are that you can go to any doctor, any specialist without referral, any hospital, any urgent care that takes Medicare, which is pretty much everybody. You're not limited to county or state, so you can go nationally. Anywhere in the United States, you can do this as well. So if you travel often, which it sounds like you actually do, a lot of traveling, this would probably be more beneficial to you than in some of the other plans, but we will talk about those as well.
Okay, well, you bring up a good point though, because this, among the choices I have, it sounds like, is to choose my doctors, and that's important to me.
Yes.
I have a great health plan now. I have great doctors that I have a long-standing relationship with, I trust, I love. I don't want to have to change my doctors if I don't have to.
Yes.
You know, so I need a plan that's going to allow me to see the doctors I want to see and continue to get care from them.
Perfect. And that actually can happen with some of the other plans as well, but what we would have to do with the other plans is we would have to actually check on the website to see if those doctors are included in there. That is one of the biggest things. There's two really big things that we take a look at when we are putting somebody on a plan. Number one is we make sure that their physicians are within that network. And if they're not, we inform you of that, and then you make a decision based off of, okay, if my specialist isn't on there, that's pretty important to me.
I see.
So I may want to choose
So
a
I
supplement
can
plan.
choose a plan and choose a plan that allows me to continue to see the doctors I want to see.
Yes.
Okay, well that brings up another question, because this supplemental plan, which sounds like the old-fashioned PPO kind of plans where you can see anybody anytime for anything.
Yes.
Right? Probably like those old PPO plans, this might be a little pricey.
That is the disadvantage to a supplement plan, is that there is a premium also. So remember, you're paying your Part B premium, whatever that is, and we don't know yet because you make over $75,000 per year. And that may change when you get into it. Well, actually, that may change next year. So actually, that will be adjusted based off of your ongoing income.
And I should point out, post-retirement, I don't expect to have the same kind of annual income that I did pre-retirement.
Right.
So I will probably be under that $75,000. So we're going to assume it's going to be the normal premium to Medicare for that part.
Perfect. So we'll assume that you're going to be at $104.90.
Okay.
And then, in addition, if we put you on an F plan, they're generally about $175 to $225. So we'll put it in that kind of range. However, again, the disadvantage is over the years that can increase, and in most cases it does.
So I started like at age 65, 175 to 250, somewhere in there. But you're saying each year that cost is going to go up as I age, assuming I might get sicker and sicker.
Actually, your medical status does not relate as to why they increase. It increases by age. They cannot discriminate on that whatsoever. So that's a good piece about it. And you go into any of these plans without any, if you've got pre-existing conditions, it does not matter. As long as you enter the plan within a certain time frame. So 3 months before your 65th birthday, a month of, or 3 months after. So we want to make sure we stay within those parameters, because if we do not, there's also, and I'll just bring this up as well, potential for penalties with the Part B. And penalties last forever. So let's say you wait too long.
What you're saying is because I like to think about things, I might want to leave here today and ponder all of this, because it's a lot of information. But I can't just wait. I can't wait and decide to do this whenever I choose to do it.
Correct. There is an enrollment period. They call it the initial coverage enrollment period, and that's where the turning 65 population generally enter.
So if I wait past that point, then I've got to pay a penalty on top of my Medicare
Part B premium. That's where the increase will occur. So we want to make sure that you get signed, which you're not going to not sign up anyways, because in your particular case, you can't have or don't want to have lapse in coverage. So you're going to be signing up within time frame. But I just want to make sure that that's clear, just in case you're like, you know what, maybe I'll wait. The only way you can actually avoid that is if you stay on your group plan for some reason. Let's say you were turning 65 and you were going to continue working, and you decided to continue working for a year and you stayed on your employer plan, then you can actually voluntarily come off of that plan and still have that 3 months before and the 3 months after and the month of.
I see. So the clock doesn't start ticking until I'm actually off of an existing plan that I'm on.
Correct, that's right. And it has to be what's considered credible coverage, and that can be either COBRA or group plan. An individual plan does not count. I had a client one time who was on an individual plan. It has to be an employer group or COBRA. Basically, the only two options for that. You gotta be careful, because if you decide, oh, you know what, I wanna buy an independent plan or an individual plan, that's going to X out that potential for those, so we just wanna be cautious of that as well.
Okay.
So, we're buying the supplement from anywhere $175 to $225, let's say, to start off with. About every year it'll possibly increase, and again, you can make the decision every single year, because in California, which is the state that we live in, you have what's called a birthday rule. So every single year in your birthday month, we can do another assessment to assess if there's any less expensive plans. So say for instance, you're on a plan and they increase it by $35 and you're like, that's not okay with me. Let's recheck, Carla. Let's see if there's something less expensive out there. There may be other carriers that offer something less expensive.
Okay, so if I get on a supplemental F plan and 6 months from now I decide I want to do something else, am I able to do something else 6 months from now?
You would do that actually, well, if you've fallen within the what's called the annual enrollment period, absolutely you can do that. So every year during annual enrollment, we could actually do it any time, but we would want to do that because of the fact you also have to add what's called a Part D, and that was the next part we were going to go into. So, but you do have options every single year during annual enrollment to do something different, which would lead us into the Part C, which I like to use Part C as being choice, just because it's my own little word that I like to use so we can kind of get a mental picture.
Okay.
It's called choice, and that's where you get onto what's called a Medicare Advantage plan. But let's stay away from that one for just a moment, because I want to talk about the D plans.
Yeah, now we're in the D.
Yes,
This
D.
is why I'm confused.
Yeah, and D, I like to use the word drugs, and it's for drugs,
Okay.
prescriptions. So, and you want to have that as well, because if you wait to sign up for a D plan, you will also end up with penalties. And those are lifelong penalties. There's only very few instances where you can avoid having those penalties. So we want to make sure Part B is signed up in time and Part D are signed up in time, because of the potential for penalties, and they're lifelong. So once you make that mistake,
Okay.
it's not a good one.
So if I understand now, I get Part A, which is hospital, from the government.
Correct.
Part B, doctors, except for deductibles, etc., from the government. Okay. Part D takes care of pharmacy, drugs, that sort of thing.
Correct.
Okay. Also government?
Yes. It's that's also governed by the CMS program, which is the Center for Medicare and Medicaid Services. So prescription drug plans are governed by that, and Medicare Advantage plans are governed by that.
Okay, but am I buying the Part D plan from the government like Part A and B?
You're going to buy it actually from a carrier, which is
From another insurance company?
Yes. So, and that will be separate in the case of a supplement. With an Advantage plan, it's actually, in most cases, 99.9% of the
Okay,
time.
so if I got a supplement plan, which you just described,
Yes,
I would have to get Part D separate from that.
correct.
Okay, on top of the premium to the government, on top of the premium to the supplemental company, I'll have a premium to Part D.
Correct.
Okay, but you're saying if I had A and B and then got a Medicare Advantage plan, the Part D is usually built into that Advantage plan.
That is correct.
Okay.
Yep, so it's
I'm
hopefully starting to
follow.
come together
Okay.
a little bit here.
Yeah.
So with the Part D plan, you'll have another premium, and those are generally anywhere from, it could be $15 to $30 per month. And then, of course, you have additional co-pays that come along with that. There could be deductibles, but again, we would assess that based off of your medications. So I would get a list of your medications, and I plug that into a program which will give me a list of the least expensive plans for you. So again, it's about least expensive, still getting all of your needs met.
I see.
So let's just say you're on Lisinopril, and I plug that into the computer. It's going to pop up the least expensive plans for that particular medication. Some people are, that's the second thing, is I think I mentioned to you that the first thing that we take a look at is doctors, making sure that those are within the networks. The second most important thing is those prescription drugs, because they are one of the most expensive costs to seniors.
Really?
Yes, yes. So getting reductions in those is incredibly important. And there are some other options too to get decreased costs if you happen to be on medications that are very expensive.
Okay. And am I buying my drugs directly from the insurance company, or am I going to my local pharmacy or mail order, or?
You actually have two options. The first one would be mail order, which that would go through the plan. They generally give you 90-day supply, 2 months 3 months supply for 2-month cost. Generally, that's what they charge you. And most carriers kind of follow the same
You get the
course.
volume discount with that.
Correct, that's right, that's right. Or you can get your monthly supply through your local pharmacies, CVS, Walgreens, those kinds of things.
Good, good.
So we actually now will shut I kind of like to call it like a light switch is what I do. So we shut the light off on A, B, supplement D, and we turn the light on over here to this choice, this part C, which is also known as the Medicare Advantage plans.
Okay, and I'm a reasonably bright guy, but what I want to do is start taking notes, because I'm not sure I'm going to remember all of this. So
Okay.
I've got part A for the hospital, B is the doctor,
Outpatient
and
services, yep.
outpatient/outpatient.
Perfect, yes.
Okay, also through Medicare.
Correct,
Okay.
yes.
And then we'll skip to D, which is the drug plan, right?
Yes,
Okay, and that's through some insurance company.
correct.
Okay, and then there's, I don't have a letter for it, but we'll call it supplemental,
Supplemental,
Okay.
yeah.
which takes care of deductibles and co-pays,
Yes,
for parts A and B. What about D?
no, they are
No.
completely separate.
The supplemental just takes care of the co-pays for A and B.
Correct.
D, I'm on my own.
D are on your own.
Okay, I got it so far.
Okay,
Good.
so that's the first column. Again, we're shutting the light off on that. We're going to turn the light off of it, our light on the Advantage plan. And Advantage is
Well, what's
actually
left? I can't imagine what else there could be.
pretty simplistic, actually. It only
really?
takes a minute to describe Advantage plans. They're basically, in most cases, HMOs, even though they have different options. Actually, maybe it isn't quite so simple, but it's not going to necessarily apply to you. But they also have special needs plans for folks with chronic disorders, such as diabetes, any kind of cardiovascular issues, which again, that doesn't necessarily apply to you, but just know that there are those options out there where they cater towards those kinds of decreased costs in the medications that are related to those diseases. And special like rides, places, if it's kind of special breathing plans, people that come into the home, they'll actually offer these additional services for folks because of the fact that they're suffering from these.
So these are
specific-
extra services you wouldn't normally get with A, B, supplemental D.
Remember, we shut the light off
Right,
from here, so
right.
that's not even.
So these are things that you don't have access to with those.
No.
And I don't have a problem at all with HMOs, except that I need to be able to see my doctors. And I know the HMO plans have a little bit more restrictive of a network. So
Correct.
what I'll need to do is be sure that I can access my doctors, the ones that have been taking care of me all along.
Absolutely, and again, that's one of the first things I do is I get a list of your physicians that you want to continue seeing, and then I plug those into the computer. And some of the different plans, one plan may have all of your doctors, one plan may have none of your doctors, another plan may have half of your doctors. So it would really, Advantage plans are very simplistic, but they're a little more difficult to assess which plan is better for somebody. So it's more work for me really is what it comes down to, but it's simplistic in the way that you actually understand how they
So
work.
what I need to do is find, if I'm gonna go with the Advantage plan, then you'd find basically the best fit.
Correct.
And besides all of the additional services and care that the Advantage plan offers, what is another advantage to the Advantage plan?
Zero premiums. Pretty much, again, I don't want to say 100% because there are some that actually do have premiums, but here in Orange County and LA, which are both in California, the premiums are $0.
So the big advantage there is as opposed to paying a premium for supplemental and paying another premium for Part D,
Correct.
you're saying that I would have that same coverage within the parameters of the HMO
Correct.
with essentially no premium.
Correct.
Okay.
Hospitalizations are $0, and again, in most cases, so I'm just kind of generalizing here. When you go outside of Southern California area, generally you'll notice that there are costs associated with hospitalizations and with doctor's visits. But here in California, Orange County, LA, $0 doctor visits, $0 specialists, $0 hospitalizations. Generally $15, $20 kind of pays for urgent cares. So again, your costs are so low in regard to all of your care.
In relationship to the others, it's much more cost effective.
Yes.
Okay, but now, as I may have mentioned earlier, I plan on doing some traveling, my wife and I, when I retire. So, and I've got this nice little comfortable network that I'm living in under the Advantage plan. But what happens if, what happens if I get sick and act to Beulah? What do I do then?
Really, the only option is emergency room. So you'd have to go to the emergency room, which is generally a $50, anywhere from $50 to $100 for a visit to the emergency room when you're out of the state.
Out of the area?
Yes, or excuse me, out of the county, because it's actually county related.
Oh, so anytime I'm out of, in this case, Orange County, I could go get care at a hospital emergency room. Is there a network of urgent cares that might be available out there? No?
No.
So it's strictly an ER thing.
Correct.
And I've got the ER cost to pay.
Correct.
Of $50 to $100?
Yes, which is, again, it's not super expensive, but you're sitting in an emergency room, you're going through that whole arduous process. So that is a large disadvantage unless you're staying in the area pretty much all of your time. You're not doing a whole lot of traveling. So it really depends. Those are the two biggest things that I look at, is that you have the ability to see any doctor in any hospital, and you're able to travel and do all of those things as well. So those are the biggest advantages to a supplement plan. So with the Advantage plans, the biggest thing is the saving of dollars, and but you're still getting incredibly good care, because there are, especially again, I'd probably, if I was in another region of the states, be I'd lean more towards a supplement plan, only because they don't have the same kind of networks as they do here in California. Here in California, the networks are pretty wide. They're very vast when it comes to an Advantage plan. And I always like to use the example that here in California, about 50% of seniors are on Advantage plans, and the other 50% are on supplements. So that'll give you an idea that these plans are all very good.
I see. Okay, very good. So I would have to give you, I assume, because I don't have access to all these programs that you put in the computer, I would have to give you my list of doctors and what my preferences are that way, so you can match them up with the right plan.
Correct.
And then you would also need, going back to the Part D, you would need a list of the drugs that I currently am taking, so you could see whether or not, there's a plan that is least expensive there.
Correct.
We can't know what medications I might need down the road.
Correct.
But I assume that a plan that is fairly well matches up with what I'm currently taking will probably work well for me down the road. Correct. And you said the other thing that comes to me is on the Advantage plan. I gotta write this down. Advantage plan, because I can't keep track. Advantage plan, it's zero premium in most cases.
Yes.
So that's first year. Is it like my cable bill, where they get me in for $18 a month, and a year later I'm paying $180 a month?
I love that you asked that question, because that's where I was going next. They cannot change any of those costs for an entire year.
Okay, but that's 1 year.
Correct.
Okay.
So every year, we would want to reassess your situation, because when it comes to Advantage plans and prescription drug plans, they change every single year. You can pretty much guarantee it.
Really?
Yes. And there's stability to it in some cases, because they have to be, the good part of it is they have to be competitive. So that's actually draws the cost down a little bit in most cases. So, but we would want to make sure we check every year because just an example, last year, a lot of diabetic insulins and pens, squid pens and things like that were very inexpensive. They actually had special plans where they weren't costing almost anything for some of these plans. Because of the fact I think they were, the cost, I think they were bleeding a lot of money last year. So they had to cut costs and they had to decrease those types of benefits. So we had to make sure that we were moving a lot of those diabetics to plans or even discussing the potential of having to change some of their medications, which that's the last resort. And they have to, of course, go through their doctor to make sure that they are getting the correct advice from their MD.
Okay, and then, so who do I follow up with here? Frankly, I would like a set it and forget it kind of situation.
Of course.
I've made the decision, looked at these things, this is the best fit for me, I'm good to go for the foreseeable future.
Correct.
But you're saying I should check back every year because the situation changes. And
Correct.
My health changes, my needs change.
Correct.
So who do I check back with?
I'm your girl.
Fabulous.
Yes.
Okay,
Yeah.
good to hear.
So every single year, we'll either check your prescription drug plan or we'll check your Medicare Advantage plan. The only stability that you're going to notice is going to be with a supplement plan. That is going to be the same pretty much for a very long period of time. I won't say forever, but those F plans are very stable. They've been around for a very long time, so you can pretty much have an expectation that they're going to stay the same, other than the premium. That's
the
what
cost
changes.
will go up pretty much every year.
That's it. That's right.
Got it.
Okay.
So I've taken a lot of notes here. I have to say thank you. I'm a lot less confused than I was before.
Good.
But let me recap, make sure I've got this right, okay? So I'm turning 65 soon, and I need to either go online, go to Social Security, or go call them to sign up for Social Security. And when I do that, if I understand it, when I sign up for Social Security, I get the A and B signed up at the same time.
That's
right?
correct, yes.
But we've got many other things to worry about. A takes care of the hospitals, B takes care of the doctors. But I have to sign up separately from that for a drug plan, for Part D.
Correct,
right?
yes.
Okay, now, that takes care of the alphabet, A, B, C, A, B, and D.
Correct.
Okay. Then I have two choices as to how I cover the additional cost. Is that right?
Your medical care, that's correct, yes.
Okay, so I've got deductibles and co-pays and all of that stuff, and that can be covered with a supplemental plan?
Yes.
Okay, so I got a supplemental plan, and that's like the old PPO kind of plans where you pretty much access anybody, everybody, and they pick up the additional cost, but it costs something every month.
Correct.
There's a premium for that. Alternative to that, if I get it, is an Advantage plan.
Correct.
Okay. Now, the Advantage plan, like the supplemental, but a little more narrow network, so I have to choose my docs, right?
Correct.
Okay. Takes care of the additional cost, plus I get Part D rolled into that, so it's all part of that.
Correct.
And the big plus there is Advantage plan. The advantage is almost no premium.
Correct.
And no co-pays?
In most cases.
Okay.
So we're talking no co-pays other than emergency care,
I see.
those kinds of things. So it depends, but in a lot of the benefits, they are $0.
Okay. And the Advantage plan also has a number of services that I think you talked about that you don't get access to with a supplemental plan or A, B, or D or anything else, only with the Advantage plan.
Correct.
Is that right?
And yeah, just to add to that, with an Advantage plan, they a lot of times have vision, dental, and rides potentially, and silver seekers, which is a
All in the Advantage plan.
again rolled up into that.
Okay.
Yeah.
So what I need to do then, I guess, is give you my information, let you know who the doctors I want to see, get you my list of current medications I'm taking, and then let you do your work, and then we can finish up and make a choice about which way we're going.
Absolutely, that's it.
Okay, well, I really appreciate it. Carla, thank you so much.
My pleasure.
I'm much less
My
confused.
pleasure.
That's great.